We all want to have a long and healthy life. And as a doctor, I realized that many of our diseases are due to aging. And that's sad, but it is the reality of life. But imagine this scenario. You walk into your doctor's office, and instead of getting one pill for diabetes, another for blood pressure, another for arthritis, your doctor says, here's a pill that slows down aging itself. And some may think that it sounds like science fiction, but a lot of you, especially the ones who are into functional medicine and latest research, understand that essentially this is our future. And the best part is that the researchers are finding that some existing medications may already have these anti-aging properties. So today we will discuss the latest article about the potential pill or pills that slow aging, and it was just published and it is in the description of this video. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. So first, I ask seemingly a stupid question here. Why target aging? So most of modern medicine treats diseases one by one. So we have heart disease, we prescribe a statin, diabetes, insulin, cancer, surgery, and or chemo. But here's the problem. Aging is the biggest risk factor for nearly all of them. So what if instead of piecemealing each medical condition, we went after the root cause? Aging itself. And that's the promise of geroscience. So geroscience is a new field, and it's not about immortality, but it is about health span, adding more years of life in good health with strengths, energy, and independence. So let's talk about biological versus chronological age first. So we all know our chronological age, and that's just the number of birthdays that we've had. And interestingly, that scientists now measure something called biological age. Biological age is how old your body actually acts based on things like DNA, your fitness, and your cell health. So you could be 50 on paper, but if your cells functioning like a typical 40-year-old, then your biological age is 40. On the flip side, someone may be 50 chronologically, but if they've got a lot of inflammation, stress, or disease, then their body could be acting more like 60. And that difference matters a lot because biological age is a much stronger predictor of your future health than just the candles on your cake. So now I'm moving to anti-aging medications, and I'll start with saying that I'm sure some of you will be surprised that the first medication on this anti-aging list is Metformin, a diabetes medication with a little secret. So how can Metformin slow down aging? So there are core concepts in aging, and I will explain how this works and give you an easy analogy kind of to help understand these concepts. So the first thing is AMPK, or AMP activated protein kinase. So AMPK is an enzyme inside our cells that acts as an energy regulator. It switches on when a cell senses that it's running low on energy. And once activated, it helps the cell produce more energy. It improves how glucose and fats are used, and it also prevents waste. It also reduces fat and cholesterol production, and in general, it supports repair and maintenance of the cells. With age, this AMPK activity declines, which means that cells become less efficient and accumulate more damage. So analogy here is that AMPK is like a thermostat that keeps your energy use in balance. So when your fuel is low, then it adjusts everything so resources are saved and used wisely. The second concept is mTOR. So mTOR is a pathway that is based also on an enzyme, also on protein kinase, and it controls growth and building in cells. So it tells our cells when to grow, when to divide, and make new proteins. So when we're young, that's wonderful because it is essential for development and repair and for growth. But when mTOR is constantly active later in life, then cells focus too much on growth and not enough on maintenance. So overactive mTOR is linked to aging, cancer, and chronic diseases. And analogy here is like mTOR is like a construction manager, great when you need new buildings, but if construction never stops, then there is no time for repairs and essentially the city wears out. The third concept is autophagy. So autophagy is the cell's recycling system, and it comes from Greek auto, meaning self, and phagy, meaning to eat. So autophagy literally means self-eating, and it is the way cells break down old or damaged parts and recycle them into useful materials. So when autophagy works well, cells stay clean and functional. When it weakens with age, damaged proteins and worn out parts pile up, leading to disease. So analogy here is that autophagy is like a garbage and recycling service, clearing out the trash and reusing what's useful, keeping the cell clean and efficient. Now let's get back to our metformin. So metformin is a very common, old and relatively cheap medication for diabetes. So the way it works that it activates AMPK. So once AMPK is on, the body uses energy more efficiently. Insulin sensitivity improves. The liver makes less glucose and less fat, and autophagy increases, helping cells clear out that damage. And analogy with metformin is that metformin works like almost turning up sensitivity on that thermostat, so it makes AMPK more responsive. So your energy system runs in a steady and balanced way. Interestingly, studies show that people on metformin often have lower rates of dementia, Parkinson's, and even some cancers. And there is actually a trial going on now called the TAME trial that is testing whether it can officially be recognized as an anti-aging medication. Our next medication that is now looked at as a potentially anti-aging medication is rapamycin. So rapamycin was first used in transplant medicine, but researchers found that it directly lowers mTOR. And we just talked about mTOR, but I did not specify what it stands for, and this was on purpose. Now that we're talking about rapamycin, I can say that mTOR stands for mechanistic target of rapamycin. It was named because rapamycin was the drug that first revealed this pathway, and that's significant. So when mTOR is reduced, cells shift from growth and toward repair. Autophagy increases, removing these, again, damaged parts, and the body focuses on maintenance instead of constant building. In animals, rapamycin extended lifespan even when started later in life, and in humans, low dosages improved immune responses in older adults. So researchers are testing whether low intermittent dosages could safely slow aging. And analogy here is that rapamycin is like telling the construction manager, mTOR, to pause this non-stop building, giving the city time to fix what's broken, to keep things running. The next group of medications are senolytics. So senolytics, and they are removing senescent cells. So as we age, some cells stop dividing, but unfortunately don't die. So these are senescent cells, and they no longer function normally. They start releasing these harmful substances that damage nearby healthy cells, and they build up in tissues, driving inflammation and frailty. And the drugs designed to target them are called senolytics. And the word comes from seno, senescent, meaning aged, and lytic, meaning to break down or destroy. So senolytic literally means destroyer of old cells. In animal studies, clearing senescent cells extended lifespan by nearly 30%. It reduced cancer risk and improved mobility. So early human trials suggest senolytics are safe and may help restore tissue health, but there's more to find out, of course. And analogy with senolytics is that senescent cells are like abandoned factories leaking pollution into our city, and senolytics are the demolition crews that clear them away so that the neighborhood can thrive again. So our takeaway here that we have AMPK that keeps energy balanced. It's our thermostat. Then we have mTOR that drives growth but needs balance, and that's our construction manager. Autophagy is the cleanup and recycling system, literally self-eating. And senolytics are the demolition teams that clear away damaged toxic cells. And the drugs, again, we have metformin that boosts AMPK to improve energy balance. We have rapamycin that lowers mTOR to promote repair. Senolytics that remove these harmful senescent cells. And together they show us that aging is not a destiny. It's actually a biological process that we can influence. Because there's so much information on anti-aging, I will continue with part 2 of this video when I will discuss other modalities and medications. Some are already being used and others are being researched, so stay tuned for part 2. If you enjoyed this video, please like, share, and subscribe. I'm looking forward to reading your comments. Thank you so much for watching. Until next time, bye-bye.